there we are, to say you understand that we are recording and you are choosing to be part of it. So please be aware that anything that you share, especially protected health information, you may have heard of it, PHI, is a choice that you have. We do ask you to be very judicious about that. We have the chat. We're going to be asking people to use the chat to give comments and questions. I will occasionally be going to what we call the speakers queue, and I will talk to you about that in a sec, but the chat is going to be basically for you to leave comments and questions that we will then record and put into a log as we've been doing. There is a link on your screen right now you'll see to get the slides for this meeting. If you're listening by phone, whether you're on the webinar also or not, or just on the phone, you can press *6 to unmute, and again to mute yourself. You can press *9 to raise your hand in the webinar. There is closed captioning available, and you can click the live transcript icon at the bottom of the screen. And we do have a web page where all this meeting information and other meetings is kept. Next slide, please. So again, we're recording. I've talked about that. Please be cognizant of what you're sharing. It is really important, and it's a choice on your part. Next slide, please. So we will have a specific amount of time at various points in the meetings for questions and ideas. After each rule topic, I will be signaled by Tiffany or Nicolette to start or to jump into the speakers queue and get that going. The best way and the quickest way for you to add your comment is through the chat. Please identify the section of the regulation you're referring to. We do ask for people not to spin off into side conversations on the chat because it makes it difficult for other people to track what's going on pertinent to what we are talking about. The comments again are entered directly into a listening log that we've talked about in prior meetings. Next slide, please. Thank you. You may you can also provide comments verbally, and again, that is through the speakers queue. At a certain point in time, I will say, okay, I will take names right now for the speakers queue, and you can do that by either pressing *6 and giving me your name only, and I'll write it down. You can put your name in the chat, for example, John Berry for the queue, and you can use the letter Q as an acronym, as shorthand for the speakers queue. And when I call upon you, please identify the section of the regulation or rule that you're addressing. And you can check the listening log to make sure that your comments were captured accurately. Great. Next slide, please. So we have 100 people, 99 people here in the meeting. So everyone will have up to 2 minutes, 2 minutes at most for your comment. At the 15, and I have I'm using my iPhone here to do my timer. And when I give you that 15-second prompt that you have 15 seconds left, I will pause the timer. So I'm not taking your time to give you that reminder, but it will be real quick. And then at 2 minutes, I will stop you and ask us to move forward. So please comply with that because we have a lot of people in the meeting. Again, the listening logs are going to be used for all ideas that we get. Comments unrelated to the rule topic will be put into a different log, issues for further discussion. And we will have to add further meetings into this series if we don't get through everything. So, and I just want to say briefly again, and it's been great in these meetings. We've all been very professional and respectful, but please, we know that we're going to disagree. There's a lot of strong feelings about these issues. It's really important to families and individuals who are recipients. So, but please, let's keep a positive interaction here, even when we disagree. Thank you. I'll turn it over to you, Tiffany. Next slide, please. Oh, I'm doing this one as well. I beg your pardon. So we're going to go till 9:15. How are we doing so far? Not bad. 9:06 for housekeeping, introductions. Tiffany might have, or Nicolette might have something to add about that. But basically, we're going to be going through rule and regulation change for case management redesign. going to be talking about goals for the rule updates, and again, roles and responsibilities. And then hopefully by 9:15, we're going to get into the rule review, take that to 10:45. And then at that point, we will pause everything and move into a wrap up to talk about next steps, whatever needs to be covered. So, okay, this time for real, I will turn it over to Tiffany.
Thanks, John. Good morning, everyone. My name is Tiffany Domikos. I'm the Case Management Redesign Policy Advisor, and I am your facilitator with John today. So the purpose of today's meeting, most of you are not new to this process, so I'm going to run through our intro slides fairly quickly, but I want to have it for the recording. The purpose for today is to share our draft rules with stakeholders and gather feedback. These meetings are about the rules and their structure, and so we're going to try to stay focused on those things. Like John mentioned, we'll log requests for policy changes, but we won't be able to manage that process with these meetings. Those will happen outside of this meeting. But we are working really hard to make sure that all of your feedback is documented and the department's responses are documented in writing also. Next slide, please. So quick review of the rule process. So the basics of this process are that subject matter experts have drafted this new rule structure and language. Most of it has been pulled from current rules about single entry points and community center boards and private case management agencies. We are pulling all of that together into one section of rules for case management. So that's what we're going to be going over, is how all of that kind of threads together. The next step in our process is that we bring our draft to the stakeholders for review. That's what we're doing today. Next, our subject matter experts and leadership incorporate the approved updates and suggestions from you all. And then next, our team will send the rule drafts for approval to our program integrity team, our HCPF leadership, budget, and legal through a clearance process. And once that has been cleared, then we have a final draft to send to our medical services board. Next slide, please. So because this rule revision is so big, we will be meeting with the medical services board in advance of our initial hearings to prepare them and orient them to kind of what this process has looked like, how to find the rules and where they've been pulled from, so that they can kind of understand what our process has been. And then our final drafts will go to the medical services board coordinator, who will post those for public comment and then send to the Attorney General's office for a formal review. Next, we'll present to the medical services board and answer any questions that they might have and get our approval. And then our rules will go into effect. Our hope is January 2024. Next slide, please. I do want to call out that this is a little bit of a different timeline than what we had originally thought or hoped because of some of the delays because of our systems. We have had to make some changes to our timeline. So currently, this is where we stand with our timeline. We're in the middle of stakeholder engagement. We'll go through the clearance process this summer and early fall and do our initial presentation to the Medical Services Board in September, have our public comment in October, and our hearings with the MSB in the Medical Services Board in November. Again, final rule adoption in January. Next slide, please. So why are we doing this? So most of you have heard of case management redesign and us pulling the case management system into one singular system across the state. So our current rule structure is fairly fragmented with pieces of rules kind of all over the place. Next slide, please. This can be really hard for people to find what they need, to understand what the flow is and what relates to what. So we have proposed a new rule structure, and this is kind of what we're following, where we start with the waiver and program requirements. This sets us up to define all of the eligibility criteria for waivers in the rules. And as we've talked about before, there are no changes to eligibility happening with case management redesign. So all of that has stayed the same in waiver and in rules. Next, and where we're at right now, we move into the case management rules and CCB requirements. This includes case management agency responsibilities along with individual case manager job responsibilities. As we talked about last week, we're looking at integrating case management agency requirements with case manager job responsibilities. So we will be weaving those together, and you'll see more of that in 2 weeks. And then the last 2 sections will be service definitions and provider requirements, which will be our next section of rules to review with you all starting in May. Next slide, please. So through this process, our hope is to reduce the duplication in the rules and remove any areas that are obsolete or might have areas of conflict with each other, or maybe are not applicable to case management and home and community-based services anymore. So we're going to clarify case management, provider, and member roles and responsibilities, and put all of this into a structure that is easy to follow and easy to understand. Next slide, please. So I want to call out the difference between rule restructure and rule changes. So you'll see in our document that rule restructure is either in black or green. And that's really where we're just moving the rules around. Nothing has changed. That those are consistent with what is currently in place and in practice. Changes would be new requirements. So that would be in blue. And what you'll see in our document will be in blue for those major changes.
Hello,
most of what we're
this is John
talking
Barry.
about.
I wonder if folks.
Oh. It sounds like we're having some difficulty with another possible webinar. John's helping us fix it. Okay. So most of what we're reviewing is really just that restructure. And what we're looking for from you all is this a logical place? Is this language outdated? Do we need to make updates to make it more plain language? Are there any errors? Is there better language to be using in those sections? And you all have done a really great job of giving us that feedback. Again, what we can't get into is the actual policy decisions. Most of those have been made at this point. This is just the fleshing out of what that looks like in rules. Next slide, please. So for these meetings, our roles and responsibilities, as most of you know, we have a facilitation process. So myself and Nicolette Cordova and John Barry are doing introductions. We're monitoring and moving conversations, walking through the rule changes, working on timekeeping, making sure that we can cover everything that we have to cover in the time that we have. Our healthcare policy and financing subject matter experts, they are the ones that are addressing the questions. These are the folks who have proposed the language. They will have more background on why things are the way they are, why we have to keep them or we can change them. They will be looking at things like statute and previous rules along with current direction that is out in the community and waiver language. And then last, our home and community-based services strategies incorporated is our contractor who is doing all of the record keeping and kind of the detailed management of all of this in the background. So they're keeping track of the listening logs and the issues for further discussion and making sure that we have timely follow-up. Next slide, please. So our listening logs, we have 182 lines and counting. We will continue to log any of the comments and questions that are made, go into the listening log. Any issues that we need to discuss and have smaller work groups outside of this goes into the issues for further discussion log. Both of these can be found on our website. Right now, they are being updated live as we are talking today. Let's go 2 slides. For today's review, we are continuing with the case management agency overall requirements. We'll start with the community advisory committee and go through this list of requirements. I know it seems pretty hefty to get through in an hour and a half, but again, most of this has been pulled from current rules and current practices or current direction that's been given by the department. So we'll highlight kind of what has been changed and then ask for your feedback on those places. Next slide, please. I will just quickly call out, as I did last time, there is a difference between rules, contracts, and provider agreements. So rules define what must be or must not be done by all case management agencies to comply with the mandatory guidelines. But it doesn't necessarily have all of the requirements of a case management agency, because some of those live in our provider agreements and our contracts. So contracts are legal agreements. Contracts and provider agreements are legal agreements between the department and the case management agencies. They have boilerplate requirements. They are specific to specific types of payment and specific pieces of the case management agency job requirements. And so if you look at our rules and feel like, gosh, this does not encompass everything that we're doing as a case management agency, or that we expect a case management agency to do, this is part of why. The rules are just one place where the requirements are fleshed out. Contracts and provider agreements are the other 2 places. So when you hear our staff mentioning, oh, that's in contract, then that's part of why you might not see it in the rules. Next slide, please. So here's just a quick snapshot of some of the differences between a contract and targeted case management reimbursement. So contract has specific deliverables. Targeted case management is based on the services that are provided monthly. Next slide, please. I hope that makes a little bit of sense. I don't want to take up too much more time on that, but happy to go into more detail if it's needed. So changes to SPOT today, as you're looking at the rules with us, is this new structure. So again, we have case management agency responsibilities all in one place. You'll see the difference between member and individual. So a member is someone who is already approved for services, and an individual is someone who is applying or has not yet been approved. Case management agency will replace single entry point and community center board, wherever that's applicable for case management responsibilities. And then we're aligning the rules with contract waiver and statute. So things like TCM, targeted case management versus administrative case management, community advisory committee, grievance and complaints, case management agency exceptions process and portability, coordination with community partners, and specific timelines that are required. And I think with that, that is everything. So we will jump into the rules. I'll give Nicolette here a second to pull those up and then hand it over to her. Are there any questions off the bat? I see the question about, are we, so we are going over rules that we started 2 weeks ago. So we'll start on page 10, and we are hoping to get through page 23. We'll see how that goes. But this will be the end of the case management agency responsibilities. And then in 2 weeks, we'll be talking about the case management agency and case manager functions. And we'll get more into service planning and assessments and monitoring and those kinds of things. So Nicolette, I will hand it over to you.
All right. Hello, everybody. We're just going to jump right in and get started. This is where we left off from a couple of weeks ago. We're going to start with the Community Advisory Committee. Just as a reminder for anybody who may be new joining, I'm just going to be going over, you'll see a lot of stuff in black. That's all things that just haven't changed. There's no differences. Anything you see here in blue or with these backslash lines, those are the major revisions to look for. Anything that is in green or has the little braces around them, these are things that are just, it's either similar language that we are just trying to make more comprehensible or user-friendly, or they've just moved from another section and we brought it into this section. Anything that you see here with these brackets and in red, these are outdated references that are to be updated. And anything that you see the line through, that is something that is being removed. Anything that may be grayed out and bolded here, that is areas requiring further review. So, that one. All right, so I will jump into the Community Advisory Committee. So first off, you'll just see that we've changed that language. Everything will now in green go to Case Management Agency. It may have been SEP or CCB in the past. Number 5, the same there. Moving to, we've just changed to Case Management Agency. And in C, I will start reading these off because these are new. Community Advisory Committee membership. The Case Management Agency shall demonstrate efforts to recruit members of a Community Advisory Committee who represent the characteristics of the community as it relates to diversity of race, color, ethnic or national origin, ancestry, age, sex, gender, sexual orientation, gender identity and expression, religion, creed, political beliefs, abilities, and disabilities. Number 2, we've changed to, instead of districts, define service areas, and physical and or intellectual disability professional was added in there for an extra county commissioners, area agencies on aging, medical professionals, also physical and or intellectual disability professionals.
Can you make the text a little bit bigger, please?
Sure thing.
Since you've got, yeah, yay, thank you.
Better? Sure, no problem. All right, number 3, regional representation from one or more long-term services support member or family members of individuals receiving long-term support services. 1, members with IDD and or members with disabilities. Self-advocates shall be given priority of selection over family members. Number 4, shall have a membership count and quorum based on the number of people served. So case management agencies that are serving 400 to 2,000 people will have a committee membership count of 5 at minimum with a quorum of 3. Case management agencies serving 2,000 to 7,000 people will have a committee membership of 7 at minimum with a quorum of 4. Case management agencies serving 7,000 or more people will have a committee membership of 9 with a quorum of 5. And number 5, in the event there are more than the minimum number of committee members, the quorum must be the majority of the total member count. If the quorum is not reached, the committee must adjourn until the quorum is met. D, the Community Advisory Committee is an advisory body that provides recommendations to the Case Management Agency and is not a decision-making body. E, the Community Advisory Committee members shall be trained in confidentiality and mandatory reporting by the case management agency. F, the Community Advisory Committee shall maintain public notice of meetings, meeting minutes, and documented follow-up. The Community Advisory Committee shall report to the case management agency governing body quarterly all case management complaints and grievance trends and follow-up. The Community Advisory Committee shall provide reports to the department and its committees upon request. The Community Advisory Committee may be combined in purpose or name with the other case management agencies committees in the case management agency defined service area, so long as it meets the above purpose criteria and reports. And C or J, the case management agency must provide an annual summary of the Community Advisory Committee in its long range plan and presentation to the department. Let's see how much we have left. So we'll just stop there, I think, for questions, and then we'll continue to the next section.
So this is John Barry. I put into the chat an instruction about how you get to the raise your hand on the webinar, but you hover over the reactions button on the bottom, click that, and it will show you how to raise your hand. You can type your name in the chat right now to get into the speaker's queue as well, or you can right now press *6 and give me your name. Anyone have any questions or comments? Okay, Maureen, I have you down. Thank you. Anyone else? I see Tara has her hand raised. Great, thank you. Okay, we'll start there. Maureen Welch, please go ahead. Thank you. 2 minutes, please.
Hello, this is Maureen Welch. I wanted to mention that this entire section, it defines the group, but it doesn't say who the appointing authority is. And secondly, for F, the public notice of meetings, meeting minutes, and documented follow-up, I'd like some additional language in there for availability of streaming online and call-in options for both audio and visual for equity of access. Thank you.
Thank you, Maureen. Next up is Tara Keene. Please go ahead. 2 minutes.
Hi, thanks, John. I just had a question around I guess it's G, around the Community Advisory Committee reporting to the case management agency about complaints and grievances. Seems like it would frequently be the other way around, that it seems like most of the time complaints come to case managers, case management supervisors, and the case management agency should be reporting to the advisory committee on those trends and follow-up. So I guess I'm just confused how that process is kind of flipping things on their head.
Hi, Tara. Thanks for that question. Can you remind me what letter you're looking at?
It's G.
So this is to, it's both. So the case, I believe it's in, if it's not in here, we should add that section. In the grievance and complaint process, I believe there's a section that they have to, case management agencies have to provide their list of complaints and grievances to the Community Advisory Committee for review and feedback. But there's also, we want to provide an opportunity for the Community Advisory Committee to take complaints and take them to the case management agency on behalf of members. If there is concern about retaliation, or if they don't feel comfortable telling their case manager that they have a complaint against them, that the Community Advisory Committee would be a place where the public could come to give feedback about the case management agency.
Okay, I can understand that. And I think some clarity, and especially if we're trying to make sure like things are together in these new rules, not splitting those two into two different sections would be helpful.
Great. Thanks for that.
Thanks.
Thank you. Lori, you're up next. You have 2 minutes. Thanks,
Thanks.
Lori.
I have a couple of quick things. One, I put in the chat, especially based on Tara's comments, when we're thinking about the role of the Community Advisory Committee. I don't think it's very clear. Its purpose is very clear. So really defining what its job is and its scope of work would be really helpful for us to all understand what that means. And then again, information, depending on its scope of work, the Community Advisory Committee would need to be able to ask for information as well as just provide information. So I think we just need more clarity on what is the scope of work and then two-way flow of information.
Great. Thanks, Lori.
Thanks, Lori. Christy, you are up next, please. You have 2 minutes. Thanks.
You bet. And sorry, I think I'm getting ahead of myself a little bit. This really is more of a style suggestion for the next section and throughout all the rules. The department's using the language grievance or complaint. And I would suggest, for the sake of brevity and plain language, that the department pick one or the other word, because what happens is they get mixed up and mixed around. And I think there's a chance for confusion. Are grievances and complaints the same thing? Are they different things? And so my suggestion would be to pick one of those words and throughout the rules and do away with the other.
Okay, great. Thanks, Christy.
Thank you, Christy. Jerry Froney, you're up next.
Thank you. My comment is about the advisory committee. I'm wondering if there's an assurance here that anyone who was disabled to the point of being necessarily homebound could be a member of this group virtually, and that would be assured in rule for just just disability access.
Yeah, I think that was similar to what Maureen suggested, Jerry. So we will take that back to the team and add that equity piece in there for people who are disabled or even who just would rather participate virtually.
Well, then as a follow-up, when we have our next case management redesign meeting, how will we know the result of what Hicktoff decided moving forward?
It is all documented in the logs. So everything that is said here is documented in the logs and the department's responses, whether that happens today or tomorrow or in 2 weeks. So you can go through the logs and see all of the department's responses for all of the questions that have been asked since we started meeting in November. There are some outstanding ones from 2 weeks ago, as department staff need to get together and talk through with leadership and different teams to make sure that we can agree, or if we disagree, then why. But all of that is documented in writing in the logs.
That seems to me pretty cumbersome for the average community member to have to go through all of that to find out what happened to a particular issue.
Yeah, I'm sorry about that, Jerry. With our time constraints, there just is not a whole lot that we can do about that. We're trying to follow up as soon as possible. And we have a lot to get through. So I appreciate that feedback. We'll try to find ways to give updates on things that feel like a big point of contention.
Okay, Thank you, Jerry. Jose Torres, you're up next. Sir, you have 2 minutes. Thank you.
Thank you, John. Tiffany, and everybody else. I wanted to highlight a comment that Mona made in the chat is number 325. How will you prevent a CMA from selecting people that may have a conflict of interest and are free from nepotism? And I think that's a great point, especially when we're talking about the case management and the governing body.
So I think that's a great call out, Jose. And we will we'll take that back to the team on how we can kind of beef up that section on the requirements to make sure that there is no conflict of interest.
Okay,
Thanks, Jose.
We'll move forward at this point. Thank you, everybody.
I just want to, Maureen, I know you asked about who is appointing, and it is under letter A. The case management agency shall establish and maintain a community advisory committee for the purpose of providing public input for case management agency operations. So I know you've mentioned that a couple of times. We will put that in writing in the logs, but I just wanted to say that out loud. And then we can move forward. Go ahead, Nicolette.
All right, we will keep going. Next, we're going to go to the grievance and complaint process for clients and members. All right. Every case management agency shall use the department prescribed case management agency complaint log and have procedures setting forth a process for the timely resolution of grievances or complaints of the person receiving services, parents of a minor, guardian, and or legally authorized representative as appropriate. Use of the grievance procedure shall not prejudice the future provision of appropriate services or support. The procedures shall be provided orally and in writing to all persons receiving services, the parents of a minor, guardian, and or legally authorized representative as appropriate at the time of admission, at any time of changes to the procedure occur, and annually at the time of service planning. All grievances and complaint procedures shall be made available on the case management agency public-facing website. The grievance procedure shall, at minimum, include the following: contact information for a person within the case management agency who will receive grievances, identification of support person or persons who can assist the client or member in submitting a grievance, an opportunity to find a mutually acceptable solution. This could include the use of mediation if both parties voluntarily agree. Timelines for resolving the grievance, consideration by the agency director or designee if the grievance cannot be resolved at a lower level, assurance that no member shall be coerced, intimidated, threatened, or retaliated against because the member has exercised his or her right to file a grievance or has participated in the grievance process. Review of redacted grievance log and resolution with the Community Advisory Committee. A geographic exceptions process in which the case management agency describes their procedures for a member to be served outside their current defined service area, which should include dispute resolution with the department's involvement. The department will review the grievance procedure and logs annually to ensure appropriate resolution of complaints and grievances and provide feedback and follow-up to the case management agency as necessary. If an agency goes without grievance for more than 2 years, the department will require the case management agency to complete a statistically valid sample for their annual satisfaction survey for 2 consecutive years to garner feedback from members and families. The department will maintain a website form allowing for community members to make anonymous complaints regarding the case management agency and their services provided. And that, I think we can stop there and take questions.
Okay, folks, so if you want to make a comment or question verbally, you can unmute your phone, press *6. Give me your name right now. Anyone? You can also raise your hand in the webinar, as 2 people have done. Thank you. You can also type your name into the chat. Okay, let's start with Lori. You have 2 minutes, Lori. Thank you.
Thanks. I don't think I need 2 minutes. I mentioned this the last call. I think it's really critical that we take number 8, this geographic exceptions process, and remove it from grievances per se, because it may not be because there's a grievance against any case manager or provider. It's not about switching. A geographic exception is not necessarily related to a grievance. Somebody may not have done anything that would rise to the level of a grievance. It may just simply be the desire to stay with a particular case manager or simplify things for someone, as opposed to somebody did something horrible and we need your approval to get out of that situation. So there we have it.
Thanks for that, Lori. We'll
Thank
take that back to the team and discuss where we want to put that.
Thank you, Lori. Nancy Vigil, you have 2 minutes. Thanks. Go ahead.
Thank you, John. Just a couple of comments. I really do think that grievance and complaints need to be separated, or one language be used. It does cause a lot of confusion. Even like A, where it says every case management agency shall use the department's described complaint log and have procedures setting forth. I think that will cause a lot of confusion statewide if all case management agencies have different processes or procedures to follow in the grievance and complaint process. And on number 7, where it says review of redacted grievance log and resolutions with the Community Advisory Committee, is that meaning you want us to redact the person's name and the person complaining?
That is my understanding. Did you have more to say about that, Nancy?
Yeah, no, I wanted to be sure we knew what to redact.
Gotcha. Okay.
Yeah.
Okay, thank you, Nancy. Jose Torres, thank you. You have up to 2 minutes. Go ahead, please.
Thank you, John. Yeah, I wanted to say that ever since this process of the rule revision started, I feel a little, it feels a little like this meeting is only a token, only a check mark to say that you brought this to us, but because what we say is not talked about. So what's in the log, for example, you say it's responded through email, but the truth is that it will be much more transparent and provide much more clarity if you provided feedback as of what in the log, which suggestions have been taken serious and have been incorporated versus which ones have not. That will provide a great clarity for us advocates. I don't like when it's just being, I'm just told that it is added or it is taken serious, but without seeing any results.
So I was just reminded that at the end of all of these meetings, we will be doing a wrap-up session where we will pull out and highlight the areas that have been accepted, quote unquote accepted, and which ones we have not been able to accept. This will also be reflected in the public comment portion of our presentation to the Medical Services Board. So there will be verbal follow-up that will be coming.
Okay, thank you, Jose. Maureen Welch, you're up next. You have 2 minutes. Thank you, Maureen.
There we go. I'm unmuted now. I had comments on 2 sections, number 6 under D, section D, number 6, assurances. I don't know what an assurance is. And as a person who has experienced intimidation and retaliation for my advocacy at my former case management agency, I really think that is not clear. Mona put that in the chat also. My other comment is on section number 8. This is a huge topic, and I'm here representing a lot of families that are not comfortable speaking out, but the restriction in this section of requiring a geographic acceptance process, which does not exist now. Currently, anyone can get a new case management agency if you find a willing and able case management agency. It's a step backwards. This section should not require a person extra burden in order to exercise person-centered choice. And it's just completely wrong. And it's a huge issue in the community that this case management redesign is actually entrapping us into an agency unless we take the risk and come forward and are forced to do something that is not required now. So please, this entire concept should be eliminated, struck out, and we should go with the current situation where if you find a willing and able case management agency, that you can make that choice. Thank you very much.
Thanks, Maureen. We will take that back to our leadership.
Thank you, Maureen. Pat Chamberlain, you're up next. You have 2 minutes. Thanks, Pat.
Well, I guess John and everybody else, I agree with everything everybody has said about number 8, and it seems to be a topic that's brought up in every one of these meetings, and we don't seem to be getting any response or any movement by HCPF. And it's not acceptable at this point to a whole lot of people. It's going to be a point that creates future problems down the road if it's not dealt with now. Person-centeredness means choice, and choice means the ability to select your own case management agency. That should be clear and simple. I agree with Lori, who said you don't always choose a different case management agency because there's a complaint or a grievance. It's because of sometimes things happen. I brought up the last time in the last meeting, somebody that has a case management agency goes to a regional center for a while, has somebody different there, is sent to wherever that would take that high needs person, and there's no continuity of care for the highest needs people. Continuity of care can be covered by keeping the same case management agency so that they know these people and they know the issues that they face and the needs, how to meet their needs better. It shouldn't be the people. I just can't imagine people fending for themselves and being able to, especially people with IDD, that can't say, all the things that have
Pat,
happened.
you have 15 seconds. Pat, you have 15 seconds. Thank you.
Oh, okay. So I want one grievance procedure, all agencies. It should be the same everywhere. Case management agencies shouldn't make that up.
Thank you, Pat.
I'm done. Thank you.
Tiffany, I think we have no more names right now for the queue.
All right, we'll keep going. Personnel system. again, we just did the case management agency change. And then we have added in a statute reference. Same throughout, and then staffing patterns, we have some changes, the minor changes. So I'll start so I can give some context at A. Each case management agencies shall assure adequate staffing levels and infrastructure to include case managers, case aides, supervisors, and other staff. Conduct all case management activities and maintain caseload sizes or ratios as set forth in contract to support the work. This includes at least one full-time case manager employed by the case management agency to provide coverage for all case management functions and administrative support in accordance with the rules. Within their staffing patterns, case management agencies shall have a policy and procedure that is posted publicly and communicated clearly to each client and member, detailing the steps for requesting a new case manager in order to provide choice to members served in their defined service area. Case management agencies shall maintain staffing patterns in accordance with the department prescribed best practice standards as set forth by the department for long-term support services caseload per case manager for all TCM activities, targeted case management activities, and all contractual requirements. Case management agency shall not exceed the best practice standards for home and community-based service waiver caseload sizes with written approval from the department. Case management agencies was added. And case management agencies must assign one primary case manager or points of contact for each member or client who ensures case management services are provided on behalf of the member or client across all programs, professionals within the agency. And then we have struck out reasonable efforts shall be made to include the client's preference in this assignment. And then we can stop there. Those were the changes. And then next we go to case management agency communication and documentation. Question?
Okay, thanks everybody. While I'm waiting for people raising their hands in the webinar or typing their name in the chat, if anyone's on the phone and wants to press *6, unmute, give me your name, you're welcome to do that. Anybody? Okay. Nicolette, seeing none.
I'm sorry, I had put my name in the chat. This is Judy Shepard.
Oh, you did. I'm sorry, Judy. Please go ahead. You have 2 minutes. Thanks.
Thank you. This part of the rules is challenging to us. I mean, we have 9 case managers total for 6 counties, and it is a very difficult process to keep quality case managers and to keep our caseloads under the prescribed number. I am not certain if the department is working on ways to support us to meet those requirements in rural areas of Colorado.
Thank you very much. I'm sorry.
I was just going to say, yeah, thanks, Judy. I've said before, the sections that are in black are pulled from other rules. So I will have to take that. We don't have as many case management staff here today from our office to respond, but I will take that back to the team to see about possibly accommodating for rural.
Thank you. Really, I mean, it's becoming more and more challenging. We get referrals by the dozens every week. I have no one to assign them to. We don't have case aides or the budget for case aides.
Right.
So we are really sort of doing the best we can with what we have, and we're not sure how to improve that in our area.
Great. Thanks, Judy. I appreciate that feedback.
Thanks, Judy. Julie Miller, you're up next. You have 2 minutes. Thank you, Julie.
Yeah. Hi. I just wanted to make a comment or ask a question, I guess, about this section. I know we've talked before about the difference between the language we're using for individuals, members, client. I guess my comment question is, why are we saying members and clients? Like, that just is kind of confusing to me. If there is a difference, maybe we just need to have a definition section somewhere, because I don't know. It's just one of those things that kind of hangs me up. I'm very black and white. I'm reading something and I'm like, what's the difference when there's two words in there that kind of seem to imply the same individual?
Yeah.
That's just my comment.
That's okay. Thanks, Julie. I appreciate that. So like I said in the slide deck, you'll see that difference between member and individual. So this should say member and individual, not client. That language should be changed at this point. I do see that we haven't changed that on letter E. So the difference is, and it is in the definitions section at the beginning of this section. We didn't go over that today because we went over it 2 weeks ago. The member is someone who has been approved for services. The individual is someone who is waiting to be approved, applying for services, or not yet approved.
Right. And that's what I thought, Tiffany, but there is a lot of places in here that says member or client. And that's where I was confused. So I think that just, yeah. Thank you.
Yep. We'll clean that up. Thank you.
Perfect.
Thanks. Nancy Vigil, you're up next. You have 2 minutes. Thank you.
Hey, John, just clarification, Tiffany, C and E. So C says that we shall have staffing patterns for all contractual and TCM activities. So does that pertain to a specific case manager or the organization as a whole? Does that make sense, what I'm asking?
Yeah, so it says CMAs. So I
Okay.
would say it's the agency responsibility.
Okay, and so quick question on the staffing patterns, because there's nothing in there that discusses like Judy's concerns. It's not just for rural areas, it's for large case management agencies too, that staffing pattern. And how, like, is it in contract that says what we shall do if we can't maintain the 1 to 65? Like, where is that information located? Will it be in rule? Will it be in contract? So that we know as a case management agency what we need to do.
That's a good question. I don't have that information off the top of my head. I believe that will be in contract.
Okay, thank you. Thank you, Nancy. We have no more names in the queue right now.
Okay. Case management agency, communication and documentation. Just updated the case management agency. And then in this section, we've added an area provided by the agency, grievance and complaint trends and resolutions. So that is just something that needs to be added to complying with their reporting and billing. And then they have to maintain accurate and detailed supporting documentation in the department's prescribed system within 10 business days. And more just where we're adding the case management agency. So all pretty much the same language going on there. And then case management agency, client and member record keeping. We've just added in the agency level for any additional documents associated with the individual seeking or enrolled in a long-term services and support program or service. I know that we usually pause at each page, but would you like to go on since there's not really much changes here? Okay, let's keep going. So this is for the case management agency, client and member record keeping. Yeah, not many changes, except for the language of the case management agency that's replaced it. And then we go to confidentiality of information. And again, just case management agencies, the only updated language there. The disclosure of confidential information shall be limited to, that code has been crossed out. And a new section was added for that statute. And then again, just some updated statute references have been added throughout there. This one was just where we retrieved that information from the old rule. And again, where we've just crossed out where we had the last regulation that is now outdated, so it's being removed. Preservation.
Let's pause there, Nicolette, and see if there's any questions or concerns about the pieces we've gone over. So we'll start with client and member record keeping section. So that's the bottom of page 14 through the top of page 16.
Okay, so folks, if you have a comment or question, you can raise your hand in the webinar, type your name in the chat. If you're on the phone, you can unmute *6 right now. Give me your name. Anyone on the phone? Okay, we'll start with Nancy. Go ahead, please. You have 2 minutes. Thanks.
Yes, just going back to page 14, bullet 1, where it says grievance and complaint trends and resolutions. Just the same suggestion Christy made earlier. Can you either use just grievance or complaints, or define what a grievance is versus a complaint?
Yes, ma'am. We will log that and then talk with the team about next steps. Thank you.
Thanks, Nancy. Anyone else for the queue at this point? Okay, seeing nothing, hearing none for right now.
All right, great. We will keep on going since not many changes have been made through here. Okay.
So then I think the next section, did anyone have questions or comments about the confidentiality section?
Anyone?
I just want to pause. Yeah.
Yep. Regarding confidentiality section, any names for the queue? Any comments, questions, folks? Okay, seeing nothing, hearing none right now.
All right. Are we good to start on preservation of member rights?
Yep.
Okay. Here we have crossed out policies and procedures of community center boards, program approved service agencies, because we are now just added in the case management agencies. Again, we're adding in some of the rules that these will be updated and crossed out old statutes that we referenced previously in the rule. The same goes for the case management agency here throughout, and the case management agency shall assure the following rights are preserved for all individuals. In these, we've added in the individual and the individual's legally authorized representative to update that language. And those are in all those sections A through E. And then also in D, we have done added the grievance and complaint system provides for all individuals served by the case management agency. And still added in that legally authorized representative to those sections. Crossed out old language here for community center board program approved service agency, updated case management agency, added in this statute, the section there, and then added in an updated statute here for reference. We've done the same thing here, added the case management agency instead, and then updated statute for reference. And then in here, for number 2, let's see, information shall be provided in a manner that is easily understood verbally in writing in the native language of the person or through other modes of communication if may be necessary to enhance understanding for the member. To make that more clear. And then we've also added in the case management agencies there. Are there any questions on the preservation of rights section I just went over?
Okay, I see one hand so far. While I'm looking, if you want to type your name in the chat, you can. Unmute your phone with *6 right now. You can do that and give me your name. Anyone on the phone? Okay, we'll start with Amanda. You have 2 minutes. Thanks, Amanda.
Thank you. Back up top on 2A, it just says and, not and or, so you probably want to add that piece in there. And then I would just like to have a comment on where you, and I had a comment on where you mentioned native language, given that that is a requirement. Is there some consideration on providing additional languages outside of English and the occasional Spanish to ensure that we're able to meet that, or to provide maybe funding in the instance we have to go seek that on our own? Thank you.
Thanks for that, Amanda. I don't have a direct answer for those, but I will take that back to the team and we will get an answer for you.
Okay, anyone else for the queue at this point? Again, you can raise your hand, type your name, unmute your phone. Okay, seeing nothing further at this point.
All right, we'll continue at member access to case management agency. Case management agencies shall have policies and procedures that include adherence to all federally mandated requirements for access to services, including but not limited to. In here, we have added in accordance with Americans with Disabilities Act statute. Again, case management agency language changes. And then there's been some major addition changes to number 4. Members and individuals have the right to person-centered case management delivery option. Case management agency function shall be based on a person-centered model of case management service delivery. Members and individuals have the right to meetings in their language of choice. Case management agencies shall provide necessary interpreters to accommodate members and clients requested. Members and individuals have the right to request an assessment be completed even if the intake case management agency staff determines otherwise. The case management agency shall have office locations and building office hours in accordance with written requirements in case management agency contract and in accordance with the Americans with Disabilities Act, and added in that reference. Did we want to pause there before incident reporting? Great, we'll take questions.
Okay, thank you, folks. Again, if you have a comment or question right now, you can raise your hand in the webinar, type your name in the chat, or unmute your phone by pressing *6. Okay, we have 3 so far. We'll start with Maureen. Maureen, you have 2 minutes. Thank you.
Wonderful, thank you. I have comments on the top of the page, numbers 4, 5, and 6. Number 4, it says here that they have right to person-centered case management. Then that should be also include free choice of CMA. Number 5, this section is sort of repeating the section that was on the previous page, which is actually worded better in my opinion. So I think that we should strike the language in number 5 and look back to page 19 under C2, where it's a more inclusive statement of being easily understood verbally in writing. And it also talks about other modes of communication. For example, spelling to communicate, sign language, or whatever communication supports a person needs. So I would recommend that we don't create new language that isn't as clear, but rather maybe replicate that section. And then number 6, I think this is kind of backwards. I understand the intent of this section or this line, but I think that actually it's putting the burden back on the members. I think the statement should read that case management agencies should not predetermine an outcome of an assessment, but rather complete every assessment that is requested of them by the member, period. So instead of saying that the individual can request it, say that the case management agency shall not refuse it if it's requested. And number 7, I actually think this is, I know it's in the contract, but I think it's kind of ridiculous because it's restricting choice. And I think that remote case management has a place, especially if we have high caseloads, that maybe we should consider allowing excess caseload to go to a remote
Maureen,
case
you got
management
15
agency by
seconds.
choice.
Maureen? 15 seconds, thank you.
Okay, so I just, since I was interrupted, case management agency office locations, I don't think that should be required. In particular, if we're dealing with geographic issues, that we should allow for overload of case management to go to an optional remote case management agency to help with the caseload. Thank you very much.
Thank you, Maureen. Sorry for the background noise. I'm trying to work on the best way to give that 15-second reminder without being disrespectful. Appreciate it. Tara, you're up next. You have 2 minutes. Thanks.
Thanks. I just have, I guess I'm a little confused about number 4 and why person-centered case management is a delivery option. It makes it sound like, you know, we have a couple of different ways of doing case management and you can choose to do person-centered case management. Shouldn't that just be an expectation? So I would potentially remove the word option, that just people have the right to person-centered case management delivery.
Thanks, Tara. And going back to Maureen's questions, I'm probably not going to touch on all of them, but I did want to mention that the reason that number 6 exists here is because this is specifically calling out the member and individual rights. There is a section around intake that says exactly what you called out for number 6, that the case management agency cannot refuse. We wanted to specifically call out that members do have a right to request that. We wanted that in writing in both places. For number 7, I will take that back to the case management team and talk through the office locations and building locations. I know that there was some discussion about this piece of that requirement. Thank you.
Thank you. Pat Chamberlain, you're up next. You have 2 minutes. Thanks, Pat.
Hi, this is in regard to number 6, and I'm a little bit confused, and maybe somebody can help me understand. Right now, there's a level of care assessment that's done when somebody requests services, and if the level of care assessment is not met, then they don't go forward with an assessment. Does that mean in number 6 that the level of care assessment is not needed at all? I mean, or that even after that level of care is not met, then they still can have an assessment? Can somebody help me understand that?
I'm going to put my case management team on the spot. If there's anyone still here.
This is Lori. Hi, Pat. Thanks for the question. So make sure I understand what your question was. So number 6 is members and individuals have the right to request an assessment be completed even if the intake case management agency staff determines otherwise. So that's saying that the CMA staff may think that the person doesn't need an LOC screen, but the member still has the right to ask for an LOC screen to be done.
Oh, maybe Lori, thank you, Lori, for responding. Maybe the word assessment here should be clarified. You know, so we're talking about this single assessment, which is the major thing, and the level of care assessment. So does that word assessment even have any meaning?
Yeah, that's good input, Pat. We'll want to take a look at that and see if we need to clarify the term assessment.
Thanks, Lori.
Thanks for the input.
Okay, we have Maureen again. Maureen Welch, you have 2 minutes. Thank you.
That was actually an error, sorry.
Oh, okay, Maureen. Anyone else for the queue at this point? Again, you can raise your hand, you can type your name in the chat, you can unmute your phone. Seems like we're mostly online. No one on the phone yet. Randy, I beg your pardon. Randy, please go ahead. 2 minutes.
Thank you. I just want to, oh, you scrolled. I just want to clarify number 6, the word request. So they can request, does that mean that it has to be done if they request it? Because it's a little confusing.
Yeah, that's a good question.
Yep, and that kind of goes with Pat's input as well, that we need some clarifying language there. So I appreciate you pointing that out.
Okay, we have someone else in the queue. Jose, please go ahead. You have 2 minutes. Thanks.
Thank you. My understanding, to everybody's point, my understanding is that members of Medicaid clients have always have the right to request an assessment at whatever point of the year. First of all, second of all, if you disagree with the assessment that you have currently, or things have changed with your life, your case, your disability, you also have that right as well, even if the CMA says otherwise. That's my understanding. I might be wrong.
Yeah, so you're saying that it's not just intake, it's ongoing case management, anytime you might have a need change.
Right.
Got it. Yep. We will make that clarification. Thank you.
Okay, thanks, Jose. I don't have anyone else in the queue right now, folks. Anyone else for the queue? Okay. Not seeing anyone.
So we will move on to incident reporting. And starting out here, it looks like the whole first page, there's not much changes. Of course, getting rid of the old language here for the community service boards, service agencies, and regional centers is just case management agencies. And then we move down to C for allegations of abuse, mistreatment, neglect, and exploitation, and injuries with required emergency medical treatment or results in hospitalization or death shall be reported by the case management agency in the department's prescribed system within 24 hours or 1 business day of being reported. And then F, we have gotten rid of the old language and added in case management agency and take appropriate action instead of corrective action. And we've gotten rid of address problematic practices identified in that section. Do you want to keep on moving or stop at that section?
We can pause.
Does anybody have any questions?
If there's any questions or comments, you can raise your hand in the webinar, type your name in the chat, unmute your phone *6. I'm looking for names in the chat, see one hand so far. Okay, Maureen, go ahead, please. You have 2 minutes, thanks.
Yeah, this is Maureen with Navigating Disability Colorado. I just think that C at the top of the page may need to be a little bit more clear. I think that one concern or one challenge we have is who was it reported to? So are you saying that you want it reported in the department system of being reported to law enforcement or human services? Or was the report made to the case manager? I think we just need to be a little bit more clear about who it was reported to when that timeline starts. Thank you.
Thanks, Maureen. Anyone else for the queue at this point? Okay, Nancy Vigil, go ahead, please. You have 2 minutes, thanks.
Just a little clarification on number C. So the overarching really mistreatment is like the umbrella, and then it's abuse, neglect, and exploitation, if that makes sense to you all. And even in 8.7205.13, it should say mistreatment and then abuse, neglect, and exploitation.
Thanks, Nancy.
Thank you, Nancy. Anyone else for the queue? Okay, seeing none at this point.
I do just want to call out really quickly, Tara, I see your comment, identifying problematic practices seems really important. That is still in here in letter F. It says the case management agency shall review and analyze information from incident reports to identify trends and problematic practices. So it's just been moved to earlier in that section. Thank you.
Looks like, Tiffany, we have another hand up while you were speaking. We'll take that. Maureen, please go ahead. You have 2 minutes. Thanks.
Yeah, this is Maureen. I'm just following up on that clarification. So what you did was you took out addressing the identified problems, and all we're doing is identifying them. So I think that that removal, that strike through of address problematic practices is actually pretty significant, because what you're saying is, you know, we need to take action too. So I just want to make sure that I don't want to say the spirit of that is still reflected in that sentence.
Sure. Okay. Thanks, Maureen.
Thank you, Maureen. So we have no more names in the queue for right now.
All right. We can move forward. Abuse, mistreatment, neglect, and exploitation. We have updated some statute reference, crossed out some language for community center boards, service agencies, and regional centers throughout the beginning of this. Move down to number 7, and again, we've just updated some statute reference and case management agency language. Number 8, we ensure prompt action at the administrative level to protect the safety of the person receiving services, as well as any other members that may have their health and safety impacted as a result of this occurrence. Number 10, just showing where some of those rules were retrieved. And then again, an update of the statutes in here to be added. And the case management agency language. That does it. Are there any questions about that last section for what we've just reviewed?
Okay, this is John. Again, we're looking for names for the queue. I see two hands raised. Before I get to you, Maureen, I'm not sure if we didn't lower your hand but from before, or you put it up again, whatever. Anyone else? Okay, we'll start with Pat Chamberlain. Pat, you have 2 minutes. Thanks.
This is just a quickie. It is on number 8, ensure prompt action at the administrative level to protect the safety of the person receiving service. Does by putting that in there mean, I'm wondering why we added at the administrative level, because it seems to me the most important thing is to protect the individual. And by putting that in, it seems like that satisfies the requirement. So I'm not sure that additional language protects the individual. That's it.
Thanks for that, Pat. And I apologize, Kidron was not able to join us today. I know that her team has been working on these rules. My understanding, and I will give you my understanding, and then we will address it in our log process. But my understanding is that allegations of mistreatment, abuse, neglect, and exploitation are reported to Child Protective Services, Adult Protective Services, and law enforcement, and that the case management agency and case manager work collaboratively with those folks, but they are not the ones to necessarily recommend the protection. Also, the provider agency has requirements around ensuring action is taken to protect the safety of the person. But I will take back that feedback about adding that language to that team and talk through with them how they might make those adjustments.
Okay, thank you, Pat. Beg your pardon. Thank you, Pat. Maureen, I believe if you raised your hand again, you're up next. 2 minutes, please.
Yes, this is Maureen. I'm commenting on the top of page 22, number 8. It talks about in the green, as well as other members that may have their health and safety impacted as a result of this occurrence. I'd like to add in physical and mental health to that to clarify it. Thank you.
Thanks, Maureen.
Thanks. Nancy Vigil, you're up next. You have 2 minutes. Thanks.
I'm going back up to page 21, A and B. You all have stricken service agencies and regional center boards from both A and B. I'm just assuming that that'll be under provider responsibilities as well.
Yes, you are correct.
Okay.
Thank you, Nancy. Is there anyone else at this point who wants to get in the queue? You can raise your hand in the webinar or type your name in the chat. Anyone else? Okay, seeing no one else for now.
I do see Tara's question about community center board, and I noticed that also, that community center board is in here where perhaps we need a case management agency. So I will also take that back. We do want to continue to ask community center boards to adhere to and require them to adhere to all of these reporting practices. So there will be some places where it will say community center board and or case management agency, not that they're necessarily responsible for the services and setting up services anymore, but still responsible for protecting people's rights and ensuring that there is no mistreatment happening.
Okay.
And then did you see Pamela in the chat, John?
Yes, I sure did. Was just gonna make an attempt with her name with apologies. Pamela Canothi. Please go ahead.
So can you all hear me?
Yes.
Okay, good deal. Thank you for entertaining my question. I'm wondering if there is going to be a timeline for non-STIR incident reports. We have some PASAs that just don't submit regular IRs, and we have to chase after them. Sometimes it actually results in a CDPHE complaint.
Thanks for that, Pamela. That will be in the next section of rules for service providers and provider requirements. So I will pass that along to that team and make sure that that is in there. This is specific to case management agencies.
Correct. Mm-hmm.
And those requirements.
Okay, thank you.
Yeah.
Okay, thank you. Liz Parr, you're up next. You have 2 minutes. Thanks.
Yes, I'm getting a little bit confused because we're talking about incident reports, which is a lower threshold than critical incidents in the IDD waivers. So one of the questions is this incident report, are you consolidating critical incident reporting with incident reports? Are you maintaining incident report threshold for just the IDD population, or is it expanding to all populations? And how will that distinction be made in rule?
Great questions, Liz. Again, I'm not sure that I have all of the answers for you or staff on hand today to answer those questions. My understanding is that this is for all waiver populations. I don't believe that critical incidents are going away. And this perhaps will be addressed in the integration of case manager responsibilities with these case management agency responsibilities. But I will take this back to the team that is overseeing these rules and ask those questions for you.
Right. I wasn't implying that critical incidents would go away. I was talking about the incident reporting at the level that community center boards, which is incident reports that don't rise to the level of a critical incident.
Right. Yeah. Thanks, Liz.
Thank you, Liz. Anyone else for the queue at this point? Okay, I am seeing no one, hearing from no one at this point.
Okay. I did see Bobby's question about a copy of the PowerPoint. I believe this is already posted. If not, it will be posted with this recording in the next couple of days. So this does conclude today's session. We will be back again in 2 weeks to discuss the case management agency and case manager functions, where again, we will be going through the rules regarding the specific job duties that are required for a case manager. So we look forward to your, oh, I see one more hand. Go ahead, Jerry.
Yes, I was just wanted to make sure that a copy of the chat will be included with the copy of the recording.
I don't believe that that is included in the recording. However,
Why not? Because there's all sorts of links and good information in there. And I think it's a mistake to not be able to access the chat.
I believe so that's not my decision to make. That was a decision made by our leadership around recordings and what to do and what we can and cannot include. All of the comments that were made here are put into the log. Again, we can put that in here in the chat here for you all to bookmark and keep handy for yourselves. Again, everything that you've talked about today, all the comments that have been made have been updated in that log live today.
There people have said that some of their issues were not addressed. So that's not a true statement.
And they will be addressed in writing.
in the future, can we get a copy of the chat at all future meetings? This is ridiculous.
So again, that was not my decision to be made. I
Well,
will take that back to
Tell
our
them
leadership.
tell them to change their minds. That's not okay with the interested public.
I appreciate that, Jerry. I will take that back and will do my best to get that changed.
So thank you, Jerry. We have, looks like one more hand raised, Pat Chamberlain. Pat, you have 2 minutes. Thank you.
Hi, I'd just like to request two things. One is I'd be glad to copy the chat as a temporary measure so that we can share it with others, but I can't do that even if I select all. So maybe you can change that so that people can select it all and copy it. And the second thing is I'd like to request that HICPUF give this point of information. How many people have chosen a case management agency outside of their normal one right now? Seems like this is a huge issue that's maybe affects a very, very small percentage of people. And I'd like to know that information.
Thanks for that, Pat. That is not information that I have offhand. Again, these are meetings about the case management rules and the structural changes and the language changes that are happening. Policy changes will have to happen in a different space. I am working with our leadership to have a discussion around this issue of choice and changing case management agency. It will not be much different than what we have right now. So we're working on it and we'll get back to you. That's all I have. I'm so sorry.
How about copying the chat? I mean, usually you're able to copy things in the chat. Today, I have not been able to do so. Can you make it so that we can copy the chat?
That is all on so the way that our structure works is that is all on the not facilitator, but there's one account, there's one Zoom account for HICPUF. So I don't have that ability, even though I'm a host. I can't make that change. That has to happen with our administrators.
Just so you know, so when you shared links, when you click on the link, you can only open the link. You can't copy the link. So it's kind of pointless to put those things in there.
Pat Chamberlain, sorry, we are at 2 minutes. I apologize. The alarm went off in the background, but looks like we have one more comment here. Jose Torres. Sir, you have 2 minutes. Thanks.
Thank you, John. So this is what I was saying when Tiffany, to be fair, when this was announced, the rule revisions, the timelines were so tight that I knew this was going to happen, that we were going to give input, waste our time, and not get any responses from you guys. So I strongly suggest that there will be some kind of public way, no email, no phone calls, to address the concerns that we have shared and that Steve is facing in the law, because this is a public meeting and it is supposed to be conducted so that our input is taken into consideration. I will remember you one more time that what I have said for many years to HICPUF is you're here to serve us.
Thank you, Jose. This is John Barry, and folks, we will wrap the meeting at this point. We do have that question entered clearly about the request, not the question, the request regarding the chat. That has been registered. Tiffany committed to a course of action that she would take. So with that, thanks everybody, and we will be back, I believe, Tiffany and Nicolette, in 2 weeks And thank you all for your input today.
Thanks, everyone. This is the only meeting for rules today, in case there was confusion. We will see you back here in 2 weeks. Thank you.